các quý chưa chắc các quý vị và các bạn. Hôm nay tôi hân có mặt tại đây để phát biểu về chủ đề rất quan trọng này. In the 1980s, a person infected with HIV often lived less than a year after an AIDS diagnosis. Today, antiretroviral therapy offers someone with HIV a nearly normal lifespan if they are started on treatment early and are able to adhere to that treatment. In 2015, there were 17 million people receiving life-saving antiretroviral treatment, up from 7.5 million in 2010. Yet, nearly 20 million people living with HIV still do not have access to treatment. In Vietnam, currently there are about 110,000 people on antiretroviral treatments, thanks to the efforts of the government, international partners, and local entities, including civil society. And we know there is much more to do, since this is only half of the people reported to be living with HIV. Through PEPFAR, the United States government has invested over $70 billion in order to support the HIV/AIDS response globally, and also invested more than $13 billion in the global fund to fight AIDS, tuberculosis, and malaria. In Vietnam, the total investment to date has reached over $500 million. As Vietnam has become a middle-income country, the role of foreign donors will naturally decrease. We are working with our partners here in Vietnam during this transition. We intend to collaborate with Vietnam through 2018 and beyond, so Vietnam can develop a sustainable and effective program. We have a narrow window to alter the trajectory of the HIV/AIDS epidemic by reaching the UNAIDS 90-90-90 targets. Achieving an AIDS-free generation in Vietnam, one in which no one is left behind, is possible, but it will not happen automatically or easily. We must come together with leadership, commitment, and a focus on impact to make it a reality. You are going to see a story tonight about people from populations most affected by HIV. The play reinforces messages about addressing stigma and discrimination, making HIV services accessible to all those who need them, and promoting increased coverage and mobilization of social health insurance among HIV/AIDS patients. I would like to extend our special appreciation to the cast and the theater crew for their cooperation and their very hard work on this production. I also want to sincerely thank the Ministry of Health for co-hosting this important event tonight. Cuối cùng, tôi xin cảm ơn tất cả quý vị và các bạn đã ở đây. Mời mọi người thưởng thức buổi biểu diễn. Xin cảm ơn.
Xin trân trọng cảm ơn đại sứ Ted Osius.